At eRoad, we believe fleet management doesn't have to be problematic. It should be effortless, connected, and future-ready for your heavy-duty operation. With a reliable, accurate technology solution, you can elevate your fleet's performance, improve productivity across your business, monitor events as they happen, and reduce costs and downtime. Get on the road to better fleet management and safer, more productive operations. Go beyond the basics and visit eRoad.com today.
Welcome to Running on Ice, the coolest community in freight. I'm your host, Mary O'Connell, bringing you the latest tech updates, warehouse news, and everything happening in the cold chain world. Not only is there the coolest show in freight, but there's Running on Ice, a newsletter that could not be colder. You can subscribe to that on FreightWaves.com/runningonIce. Today, we welcome Tiffany Brewer, Senior Director, Industry Strategy, Pharma, and Life Sciences at Blue Yonder. Thank you so much for joining us today, Tiffany.
Thanks, Mary. So happy to be here.
I'm excited for today because we are jumping back into, it's something we have not talked about in a hot minute on the show. And that is kind of the pharmaceutical and, kind of that vaccine supply chain. We've dabbled a little bit in the overall broad spectrum pharma recently, but this one we're going to get into and I'm excited. Before we get too far into that though, let's get some background on you and how you got started at Blue Yonder.
Yeah, so I have been at Blue Yonder for right around 2.5 years, and I came from a background in industry. So I had worked at companies like Pfizer and Medtronic, always in supply chain. I also spent some time at FedEx and, kind of ran the gamut of positions within supply chain, all the way from planning to execution to IBP, kind of strategic business planning types of things. So that's how I really came to Blue Yonder in this role. They were looking for someone with a very strong background in supply chain and who had that experience in medical devices and pharma. And it's just been a really great experience so far. So I've really enjoyed it.
I like that you have suffered from the same problem that a lot of people have in supply chain. And that is once you get into it, you can't get out of it and you just keep acquiring new roles and you just keep kind of going down that rabbit hole. So I'm glad that you've had a very similar journey to a lot of others.
Yes. Yeah.
So I guess when it comes down to we all kind of have gotten the texts, the emails, the notifications from insurance or CVS or whatever, it's cold and flu season. It's time to go get those vaccines. But then we also have some, we have the return of RSV. We have a whole bunch of different diseases that are just, casually appearing across the world. And since, we now live in a pretty global society, we kind of actually do have to care about diseases that are happening in other countries because the ability of them to be transmitted, here to the United States or vice versa is actually pretty high because, we have intercontinental travel. But when it comes to, everything kind of hitting at once, like COVID vaccines, flu shots, RSV, Mpox, all of that, how do pharmaceutical supply chains really prioritize which vaccines need to get there? And just kind of how do they start even prioritizing getting everything to where it needs to be?
Yeah, that's a great question. So one of the things that they first look at is where are these diseases or these health conditions kind of hitting, where are they impacting the population most? So, is there an elderly population that's very impacted and therefore, they're going to be more impacted by something like the flu? Or is it a population where there are comorbidities? So those are the types of things that are looked at. And then, all of those types of things being equal, they start to look at things like where is their infrastructure for those vaccines to kind of get out to the public. So obviously some areas have much more access to infrastructure. Those countries that have more economic stability, they're maybe the wealthier countries, they're going to have more of an infrastructure to be able to get those vaccines to the people that need it most. And, then finally you start to look at things like where is it going to impact the economic stability of a region more than another region. So, if this particular disease has more of an impact on just the general economic stability of a region, maybe it's an urban center or something like that, then that particular area is going to be prioritized. However, there are organizations like the World Health Organization, WHO, that will help to prioritize specific regions, right? So, maybe there's a region that just doesn't have a lot of infrastructure, doesn't have a lot of economic impact that would really say, oh, well, if this particular population was really hit by a particular virus or a particular disease, then it maybe wouldn't impact the global economy like you were just talking about as much as another. So they will help to prioritize those types of things, and that did happen with the pandemic that we recently experienced. So there were a couple of regions in sub-Saharan Africa that were prioritized just based on, there were a significant amount of comorbidities that occurred. And so the WHO helped to prioritize, hey, these regions, these countries don't have a large amount of infrastructure. In fact, they probably don't have the cold chain needed to really support vaccine distribution, but there is a big need. It's really going to impact this population, and therefore we need to prioritize this. We need to increase the infrastructure. Maybe the WHO and other organizations bring in some assistance for infrastructure, and therefore they get prioritized in that way.
That is a lot more complicated than I expected. I assumed there was like a rationale for it. Obviously, I am not a pharmaceutical prioritization expert, so it's really fascinating to know that there's more than just like, oh yeah, we're just gonna give it to, like, we're just gonna disperse it. Here you go. It's fascinating that even on kind of like a regional basis, it's looked at and prioritized that way versus just like, oh, the state of Arkansas has bought 40 units, or, this specific region in Asia has bought this, or something like that. It's really cool to know that there is a rhyme and a reason for why things are chosen and prioritized the way that they are, even down to like the economic level. And then on top of that, the just kind of them going, okay, well, this is a huge opportunity that we need to, this is a huge area we need to protect. So we have to kind of build up kind of the ability to distribute that, it's really cool that is something that they all take into consideration.
Yes. Yeah. And I think it, as I was just kind of thinking about that question, it makes me feel good. I think that, there are kind of checks and balances in place to make sure that all populations who need these types of medicines are served, right? And so I think that's just a very good thing to have checks and balances like that.
Yeah, I'm a big fan of that because it just kind of, it stops those that like have the means from just coming in and being like, nope, this is ours now. So we've touched on kind of how it gets prioritized, but when it comes to it, like, because there's a lot that goes into obviously vaccine distribution and the logistics behind it, because it's not just, oh, I need to create the actual medicine that goes into people. It's the syringes, it's, creating the actual medicine, because a lot of those are different components that are then put together into make the thing that actually keeps people and keeps them healthy. So there's that part too. And, so it's like, how do you even begin to start piecing these logistics pieces together? Because you have to have like the fluid that goes inside the vials, the actual vaccines, like the needles for it, the bottles. How do you even begin to like know where to start when it comes to making sure everything's in the right place to, help people?
Yeah. It's like you mentioned, it's a very complex supply chain, right? Because generally the syringes and all of the things that are needed to that are not the medicine, right? It's the medicine itself. They may be produced by a different manufacturer. And so the hospitals, the doctor's offices, any medical office that needs this equipment, they have to ensure that they're kind of all ordering within the right cadence. They have the right kinds of supplies. And to be honest, that's part of the reason that generally the medical supply chain tends to over index on inventory, right? And so what they might do in many cases, starting from the very beginning, well, maybe not quite from the very beginning, but at least from the medical device manufacturers or the pharmaceutical manufacturers, they tend to, hold a lot of inventory so that they're not short of inventory. And then you kind of get to the distributors. And there are, in the US, there are, of course, the big three distributors, but then there are additional distributors. And I think that can kind of help to streamline things, right? So if you think about, I have these big three distributors like a McKesson, a Cencora, a Cardinal Health, and they're distributing primarily pharmaceuticals. You have some others that distribute primarily medical devices, and there can certainly be crossovers between those. But I think that helps to streamline things for the medical offices or the hospitals, right? So that's part of it. But then, you also have this component where there's a need for temperature control, and you have to ensure that you're working with the types of 3PLs, transportation providers, et cetera, that have all of these really regulatory types of concerns covered. So they have the ability to maintain temperature controlled shipments or temperature controlled storage. They have all of the abilities to do sterilization and so on. And so, it is a very different and complex supply chain versus, some of the others where, hey, I can choose from a large number of carriers, a large number of 3PLs. It's a very specific niche supply chain where, these carriers, these warehousing companies, even the providers of the temperature control type of equipment and like the tracking equipment, the boxes that hold the supplies. It's all kind of a very self-contained type of supply chain.
I think that temperature control component is so important, because I feel like every time I'm reading about something that's new in the pharmaceutical supply chain, or you find out about a new medicine for something, it always is like there always is such that importance on that cold chain part of it, and I think that evolved faster than kind of almost the cold chain did. Because I mean, even just outside of vaccines, I mean, obviously we saw with COVID vaccines needing to be sort of ultra cold temperatures, but you're starting to see it kind of reach out into other areas of the medical field as well, with certain customizable gene therapies and other things like that, which is really fascinating that, we've been able to take this science and be like, oh, we can actually like help people a lot more and get them the medicine that they need to obviously feel better and, stay alive. But there's that cold chain aspect of it that I think everyone learned very quickly during the pandemic is, okay, how do I transport these ultra cold things? How do I keep them, at multiple, like, was it like 30 degrees below? Was it negative 30 degrees Celsius?
So I don't remember the specific temperature for the COVID vaccines, but yeah, I mean it's I know it varies, right? So like different therapies have a varying degree, and I know, yeah, like the COVID vaccines were like at that, like they were freezing, right? Like it was ultra
Right.
cold.
I think that those kind of being able to be widely distributed across the world kind of opened up a lot of opportunities for different medicines to be like, oh, well, we can transport this thing that's at, negative 30 degrees Celsius or negative, I don't even know how far negative it goes. I just know that it gets really, really cold and you need like special equipment to handle it. So I think that that was just kind of like that eye opener, like kind of that gateway to say, there is this whole component of the supply chain of logistics that can come in and say, yeah, we can do it. Just give us a few minutes to figure out what you have and what you need. But like, we can get you some tracking on this. We can get your negative 40 degrees Celsius shipment from here to wherever. And I absolutely love that because it's just kind of the best of both worlds coming together going, I didn't know you did this. I didn't know that you needed this. And now everyone has just kind of come up with like yeah, sure, we'll figure it out. Just give us a minute.
Yeah. I think that's right. And I mean, there's when you talk about just the component of these new therapies kind of coming along and they're life-saving or very life-enhancing, they have higher effectiveness rates than other therapies might have. And with that being said, what I always say about this industry is, everyone that you talk to is always very interested in the idea that, hey, I'm working to serve people. I'm working to make people's lives better. And so because there is that impetus of I'm going to save or drastically improve a life, then people just kind of inherently begin to work together to make these things happen. And, like you said, it's the tracking, it's making sure that, hey, if something kind of goes out of temperature control for outside of this particular range of time, there's going to be a notification that has happened, or there are all kinds of different containers that are being created to allow for storage, even if, hey, I don't have a truck that is temperature controlled, but I've got this product in a container with dry ice or ice packs, and now I'm keeping it cool for enough time for it to get to that location. I think it's just something where there are different types of things that can be done, and for now, people are just kind of trying to figure out what is the best way to do that with what we have today, and then how can we improve this in the future.
I also think it really kind of plays into, because most of the people that get into logistics, they love to solve a problem. We are problem solvers by nature. And if you have this product that you're like, hey, I got this, I don't know how to get it somewhere, that's where I think it really taps in. But like, it could potentially like help a lot of people. That's where I think it really kind of, it gets that humanitarian aspect of it, of like, yes, we're going to help people, we're going to make a difference. But it also plays into that strength of like, we're problem solvers. Like, we're going to come in and say, Yeah, we can do it, but just can we? We can, but let's figure it out. But no, I love that it has resulted in kind of this huge growth and this evolution in the temperature controlled supply chain. Because we're really kind of seeing a lot of technology come up and say like, oh, you want tracking? Okay, got it. You want to know if there's been light exposure or exactly down to what humidity this shipment was in at any given time. I love that this is something that has just bred all of this innovation and, like just kind of enhancements because we're finally getting the technology that we've desperately needed.
Yeah. Yeah.
That being said, is there any tech on the horizon or maybe that has already come out that you're like, this is it? Like this has really helped with vaccine distribution, the medical supply chain. Like this is kind of what we've really needed all along.
Yeah, so I'll start by saying where this technology was when I started in this industry, which was right around 20 years ago. And at that time there probably weren't the same number of temperature, humidity control types of requirements. It was just less, and it's only increased over time. And so, I remember working in a refrigerated environment, and there was a small freezer kind of over to the side, and that was what was needed for the operation of this particular business. And and then there were also tracking units that you put in the shipments, and they told you when you opened up the box, hey, it's gone out of temperature or humidity range, or it hasn't. And so, I think one of the things that is different is now the types of tracking that are available are more AI driven. And so these tracking, whether it's an actual physical tracking device or it's a software that tracks shipments, it will let the business know in advance, hey, this is going to go out of temperature control if something isn't done. And maybe there's something that can actually be done to stop that diversion from happening. And so that, I think, is one of the big changes that I've seen. And then beyond that, there's something maybe that's less technology related that has happened. And I would say that's just the working together of the regulatory bodies like the FDA, and working with manufacturers to say, hey, I know that you're going to need additional facilities, additional types of transportation devices, and let's figure out how we can fast track that if we can.
I absolutely love that. It's really fascinating to see kind of how far technology has come because I mean, even 10 years ago, we were still faxing BOLs to carriers. And now that's something that, like I don't even know if any like major shipper or brokerage or 3PL even has a fax machine anymore. So I think it's fascinating that we've seen everything in the supply chain really go through this huge technological evolution. And I'm here for it because let's maybe not use a fax machine anymore.
Yeah, it's definitely a lot more, I think when you talk about technology improvements and people start to think, well, how is this going to negatively impact my job? I think about fax machines, and I think about typing BOLs literally on a typewriter in some cases. And those are things that I am very happy for technology to take out of my hands.
I could not be happier for most of them. Something that technology can't take out of our hands, though, is the question that everybody that comes on the show has to answer. Tiffany, you are not going to be an exception. So, is cereal considered a soup?
I do not think that cereal is a soup. So,
Yes, that is the correct answer.
I mean, I agree, and I do have a very solid point of view on this. And yeah, it's not just because it's cold; it's because it's a dry grain that's just being mixed with soup and or well, being mixed with milk, and that is not a soup.
No, it's also they're two separate aisles at the grocery store, you know? Like there's the soup aisle and the cereal aisle. So like and the milk is completely in a different section. So like you don't find any of the components for cereal in the soup aisle, you know?
That's yeah.
So that's kind of my solid defense. That being said, I do love both. So, you know, I'm not mad about it.
Yeah, no, they're both delicious foods. They're just not the same.
All right, Tiffany, if anyone has any questions on your cereal soup or opinions or kind of how anything in the pharmaceutical supply chain works, where can they find you outside the show?
They can find me on LinkedIn at Tiffany Brewer. And that is, you can reach out to me absolutely anytime. And I'm more than happy to talk about anything related to life sciences supply chain, whether med tech or pharma, or cereal as a soup.
Thank you so much for coming on the show, Tiffany.
Thank you.
You can catch other episodes of Running on Ice right here on Freightwaves TV, YouTube, or anywhere you get your podcasts like Apple Podcast and Spotify. Need more Running on Ice news? No sweat. Subscribe to the newsletter on freightwaves.com/runningonIce. See you on the internet.